Patients with intellectual and developmental disabilities, or IDD, have their own unique set of challenges, including behavioral issues. These can include self-injury, aggression, property destruction, meltdowns, and noncompliance. Behavior is often a form of communication, and individuals with IDD may voice their wants or needs through behaviors rather than words. And particular behavior may occur because it serves a function and produces an outcome. Stepping back and considering why a person might be behaving in a certain way is the first step towards understanding how to help. It can be useful to think of an individual's actions as a response instead of a predetermined or intentional behavior. Behavioral issues can vary widely based on the specific condition, level of disability, and each individual's unique differences.
IDD patients are often hypersensitive to pain, smell, sound, and light. Busy and unfamiliar healthcare environments can trigger these sensitivities, leading to negative behaviors. They may lash out for protection or have a strong desire to leave an unfamiliar or overwhelming environment. When such behaviors arise, it is important to remember to use suggestions mentioned in the communication video and respond or intervene accordingly. You may encounter a patient who engages in self-injurious behavior. This could include headbanging, biting themselves, hitting themselves, or other actions that can cause self-harm. This may be in response to pain, anxiety, overstimulation, or the inability to communicate. These behaviors could be a way to cope with stress in that situation. You may assume that headbanging is a sign of a headache. However, this could be a response to an unidentified source of pain, such as GI issues, constipation, menstrual cramps, or even dental pain. If and when you encounter such a behavior, the most important thing to remember is to remain calm. You should not try to physically stop this behavior. However, it is important to keep the patient as safe as possible. If they are trying to hit their head against the wall and they're on a stretcher, move the stretcher away from the wall if possible. It can also be helpful to use extra pillows as barriers. If they're accompanied by a caregiver from a facility, they may come prepared with large blocking pads to use as a barrier between the patient and any hard objects or surfaces. For this reason, it is important to maintain a safe environment by moving furniture or equipment, securing sharps, and keeping a safe distance from the patient if they become agitated. It is also important to keep long hair tied back, keep name badges out of reach, and remove neck lanyards. Patient and staff safety are a priority, and on occasion, aggressive behavior may require a physical or chemical restraint. In this case, hospital protocol must be followed. Cooper has trained experts on staff to help with these scenarios, which may involve multiple team members.
When behaviors do present in IDD patients, there are two types of outbursts that are important to distinguish. Meltdowns are involuntary responses to a nervous system overload. They are the physical manifestation of a neurobiological chaos that is caused by a perceived threat. They are often impulsive and without reasoning behind them. This is a sign that the patient can no longer cope with the challenging situation. In contrast, a tantrum is a voluntary emotional outburst that usually subsides when the desired outcome is achieved. During a meltdown, intense emotions take over and may be released via self-stimulation, repetitive movements, screaming, or crying. And these will continue until the patient feels safe and calm. If you encounter either of these types of situations, it is crucial to remain calm. Use very few words or directives, giving the patient time to self-regulate. Showing an understanding and supportive presence is important and will help with the recovery phase. The mobile sensory cart can be useful during these situations. Devices such as fiber optic light strands, projectors to display vibrant images, speakers for music, and an interactive bubble tube are useful calming tools for patients and caregivers during these situations. It's important to remember that the IDD population is often excluded from psychiatric inpatient settings due to a dual diagnosis that can cause unmanageable behaviors. outpatient resources are often limited and, if available, have long waiting lists. This leaves families and IDD patients nowhere to turn except the ED when crisis-level behavior occurs. When supporting IDD patients, the entire family comes under our care. We must always remember to treat the patient and their family as a whole. Remember, caregivers and families are a great resource and can help us understand what their loved one may need. The proactive strategies we have outlined are the best way to help avoid a potential crisis when IDD patients are under our care.